etc. Because you could go from one clinic to the next and just keep on going. You can walk in and say, my back hurts, and here's the pills.
There's another component to this that we're also not talking about. Opiates give some people, maybe a lot of people, energy. And they're looking for that energy because they're always tired or whatever the story may be. So they're popping, that's another reason they keep popping all these pills.
Instead of Starbucks?
Instead of Starbucks. Oh, maybe with Starbucks.
What about the pharmaceutical companies who are giving them all these drugs? I mean, I haven't heard anyone.
Selling them. And that's the answer.
Well, I'll tell you, the biggest surprise for me is that in order to purchase these medications for resale, whether it be by a pharmacy, whether it be in a physician's office, a lot of paperwork has to be filed with the Drug Enforcement Administration in order to obtain them. I still cannot figure out how these pill mills are gaining millions of individual tablets when the DEA has to be made aware of all these purchases, unless they're purchasing them from sources other than reputable distributors.
Well, that 2 million figure came from the DEA in court documents filed in that case. And what I hear is that we've just seen the tip of the iceberg here, and I think that we're going to see probably in the next 4 or 5 months, we're going to see more action being taken, but they're not easy cases. Right, Mr. Ferrero? These are not easy cases to make.
They're very difficult cases. But when you're talking about the vast volumes that we're dealing with here, I read a statistic where with the amount that are actually flooding our state, you could give every Floridian 4 oxycodone pills.
Wow.
Excuse me. With regards to the pharmaceutical companies, I think that both the pharmaceutical companies and we as individuals have to take a little bit of that responsibility. First, the pharmaceutical companies are feeding our desire to have things fixed very quickly and fixed very neatly. We've become a culture where just go ahead and fix it, and if a pill will do it, that's what I want, because I want it fixed right now. But also, there's also the piece that the pharmaceutical companies need to take ownership of the inadvertent addict. The person who has legitimate pain, who becomes addicted because they're not getting the follow-up care, and maybe the pharmaceutical companies need to become responsible for making sure the doctors are educated and that follow-up care is provided so we're not creating addicts inadvertently.
Well, the good news to that is that the educational aspect of those administrative codes that have been adopted by the boards, the education purpose is not just to educate people who are looking to function as pill mills and just say, well, now that you have the education, you can't say, I didn't know. But also people that are out there and not truly knowing what they're doing, that are underprescribing and causing addiction because they're underprescribing or because they're not using the appropriate combinations of medications or the appropriate formulations of medications. This education will provide them with that they're actually prescribing with greater knowledge and greater efficiency.
We can't just stop opiates, that's the problem also. And if you're taking opiates, you can't just quit, because you're going to get sick. And what happens is people get deathly sick and they go back on it.
But they can do wonderful things when used properly. And you shouldn't say you should never use opiates. You just have to be careful.
I think that's one of the most important things that we can bring out at this panel here today, is that we have to make this distinction between legitimate pain and legitimate practitioners versus these pill mills. These pill mills are criminal enterprises. There are physicians out there every day who are going to work and saving lives and making people better and having actually livable lives who are dealing with severe chronic pain. And we can't even forget our end-of-life stage individuals who are really in need of these types of medications just to simply have a quality of life in their final days.
But a lot of these medications that they manufacture are getting more and more powerful, and they're becoming more and more addictive, and it actually changes the brain chemistry. So you don't think the same way that you would normally think. And even if you prescribe them properly, you take one, your body gets used to these pills. Then you take one every 4 hours, and it becomes 2 every 2 hours, and it becomes 9 every 1 hour. And eventually people just get accustomed to taking them because it's not working the same way anymore. So there's a lot of education that has to be done for the clients, the patients that come in, and let them realize that, hey, if you start doing this, you have to come back in here because you're becoming addicted.
Right, we have to take it down.
And
Jack will take you down.
And no matter who it is, if you're taking a medication, an opiate, whatever the medication is, your tolerance will eventually build, and you'll need more and more of that medication. That's the fact. Your body gets used to it. However, that's why I want to make a clear distinction. When someone has chronic pain, they're using the medication as prescribed, and we have to keep on upping it. At some point in time, they will have to go through detox, but we do not use the term detox for those patients anymore. We call it a transition, because then it makes them see that they are an addict.
Right.
If they use detox, transition is you may have to go back on the medication again, but we have to go through a transitional period.
Yes.
My question also falls along the lines of differentiating legitimate versus illegitimate. So when you punish a doctor for illegitimate use of these drugs prescribing, how do you balance disincentivizing illegitimate use from scaring off doctors from legitimate use?